We identify now patients based on the B fast. Now some patients will not have a stroke, but they will look like as if they are mimicking a stroke. Most important factor is of hypoglycemia. So a diabetic patient who has taken the injections or the tablet but not taken proper meals, then that time the sugar can go low, and that can look like a weakness of one side of the body or whole body. There can be a altered sensorium. The patient may be drowsy, you may not be able to wake him up. So it's a good idea to do sugar testing if there is a glucometer at home. Usually a sugar of under 70 is taken as hypoglycemia, and treatment should be given through glucose. Now this glucose is given by either IV method if the patient cannot swallow, or the hypoglycemia is very severe, or orally when the hypoglycemia is very mild and the patient can swallow. Now there are many other conditions which can look like a stroke. We should not go into all that details, but there are a few occasions when the stroke will not have that manifestation of B fast. So it will be something different, some other presentation. So what are those other presentations which could also be stroke and we should be aware? So a person has suddenly a lot of vertigo, no problem with body balance, but only things spinning, or there is a movement disorder. Movement disorder means suddenly there is an abnormal jerky movement in the hand or leg, or the person is suddenly confused. So then sensory abnormality. One cannot have one can have just a pure numbness on one side, maybe face, cheek, hand, leg, or there is a acute amnesia. So individual who keeps on asking, where am I, who am I, where am I going, that is a acute amnesia. That could also be like due to a stroke. And shaking TI means there is a blood supply which becomes less for some time. Again temporarily the artery opens up, so there can be a limb shaking episodes. When the blood supply is less, the limb shakes vigorously, and when the blood supply is restored again automatically, then the shaking stops and the person is able to move the hand and leg.
Subscribe now and press the bell icon. Never miss an update.